Good evening and welcome to IHW Council's special web series on RH negative incompatibility. I'm Anisha Rayadhavan and you're watching our exclusive show on RH negative blood group and its impact on pregnancy. A healthy pregnancy is a celebration for the entire family to welcome a new member. But there are a few things that would be parents should be aware of when starting a family. One of these issues is RH incompatibility. This occurs when a pregnant woman whose blood type is RH negative, for example, let's say B negative, is exposed to the RH positive blood of a fetus. Let's say it's B positive. Because of the incompatibility, the mother develops RH antibodies which have the potential to cross the placenta and attach or destroy the fetus red blood cells. This causes the fetus to become anemic, and in severe cases, the baby may need special blood transfusions called exchange transfusions, either before birth, which is called an intrauterine fetal transfusion, or after delivery. Now, our show today is special because we're going to talk about RH negative blood group and its impact on pregnancy and address some of the questions that you may have on this aspect of pregnancy. To guide you for this and to answer all your queries, we have with us Dr. Kushagradhi Ghosh, a Senior Consultant, Obstetrics and Gynecology, Institute of Fetal Medicine, Omega Clinic, and Bhagirathi Neota Center, Kolkata. Welcome to the show, Dr. Ghosh.
Well, thank you. Good evening.
But before I begin our conversation with Dr. Ghosh, I would request all our viewers today to keep sending us your questions on in the comment box. You can type it in, and we'll try to answer all your queries, as many as we can, over the next 30 minutes. Do like and comment with your feedback on this page. To share this page with your friends and family if you think they may also benefit from all the information and the expert views we bring in. So let's bring in Dr. Ghosh. The RH negative incompatibility is perhaps the last thing, would-be parents would think about. Is this a big problem? Is there any awareness about this at all amongst those who are thinking of starting a family?
Right. It's a very important question. In fact, there are two parts to this question. One is a large part of RH negative women population in India, as you rightly pointed out. In fact, we have four types of blood group: A, B, AB, and O. And each of these blood groups can have negative and positive. So in fact, we can have 8 types of blood groups: A positive, A negative; B positive, B negative; AB positive, AB negative; and O positive, O negative. Now, all these negative blood groups, whether it be A, B, AB, or O, pose a little problem. Now, the magnitude of this negative population in our country is around 5 to 10%. In Caucasians, like in UK and USA and in Australia and in Europe, the proportion of RH negative population is around 15%. So they have a more large problem compared to us. But in our country, it is about 5 to 7%. So if, for example, an RH negative mother happens to marry an RH positive father, then as you rightly mentioned, there is an incompatibility. In what case the blood group incompatibility occurs and the baby suffers some problems, which probably we're going to discuss later on. Now, that is the magnitude of the problem. And the magnitude of the problem is almost equal all throughout India. But it's not that in South India it's more, in North India it's less. It's not like that. So like thalassemia is more common in North India, whereas it is not common in South India. But regarding RH negative problems, majority of the cases occur, all the cases occur uniformly all over India. Now next question is about the awareness. Now, the awareness of this problem is very, very low, especially in rural and suburban centers and villages, because women and men also don't even know their blood group. In some of the schools in Kolkata, for example, there is a routine testing which is done by the school authority before entering the school or during the school days or college entrance. They would know their blood group. Or sometimes when women or men start their office work or start a salaried job or whatever, then it becomes an incumbent. It's almost necessary to get the blood group done because of the badge and things like that, name tags. So that's how we know our blood group. Until and unless, of course, there is an operation which is going to be done on somebody where blood group is essential. Apart from these, nobody actually goes to the clinic or to any diagnostic center to know what is my blood group, unless they are a blood donor. So the situation of knowing the blood group among Indian population itself is very low. Now, when these population enters into their childbearing age and they ultimately become mothers and fathers, most of them, I would say more than 90% of them, I'm talking about whole India, I'm not talking only about Kolkata, Mumbai, Chennai, or Delhi. Majority of them would not know their blood group. So the awareness about blood group, knowing the blood group, especially during pregnancy, is very, very low. Now, the first time probably a blood group is advised in majority of women is when they become pregnant. And when they become pregnant, then routinely, it is a routine which is done all over the world by all the guidelines, and also in India by our FOGSI, the Federation of Obstetricians and Gynecologists of India. They have recommended that all pregnant women should have blood group tested on the very first visit. When the blood group is negative, they're found to be negative, then it is imperative that the spouse also gets a blood group checked. So as a whole, to answer both your questions, there is a huge demand for blood group knowing, which is a challenge. And secondly, is that, yes, the awareness is very, very poor.
But Dr. Ghosh, if a woman is RH negative and her husband is RH positive, can we say 100% that there will be a problem during the pregnancy? Or is still just a matter of chance? It could be that the baby that is not RH positive, he gets, an RH negative blood group.
Yeah, this is also a very good question. There's no point in getting scared in a way that whenever a woman who is negative marries a husband who is positive, all the babies will get affected. No, but the chance of getting affected is very high. Like, for example, if a mother is RH negative and the father is RH positive, then there is a 16% chance that the baby would be affected with RH negative positive incompatibility. In our age, in the 21st century, 16% is very, very high. When we are talking about a problem rate of less than 1%, there should not be any complication, which in total should be more than 1%. So 16% of RH incompatibility, where the mother does not suffer usually, the baby suffers, is too high. So that is the overall problem. So in majority of cases, like in 80%, the fetus will probably escape. But 16% is a very high price to pay.
And you can't take that risk. So the question we've already started getting a few questions. And one Facebook user is asking, how can RH factor incompatibility be prevented? Can you prevent this?
Okay, that's a very good question. Now, today, actually, we are going to talk mainly about prevention, because treatment is something which is done in higher centers like fetal medicine centers. So this is a very pertinent question in today's talk. The only way to prevent RH incompatibility is to know the blood group of the mother, know the blood group of the father as soon as possible in pregnancy or even before pregnancy, and do a test which is called an indirect Cumb test. If the indirect Cumb test is done and if it is negative, then the mother receives an injection which is called AntiT injection at around 28 weeks of pregnancy. That would prevent RH incompatibility from the tune of 16% to less than 1%. Now, even after that, when the mother delivers, then the blood group of the baby is known. If the blood group of the baby is done within 24 hours and up to 48 hours, and we know that the baby is positive, like the father, then the mother has to receive an extra dose of anti-D within 72 hours of delivery. Say, if we do the antenatal prophylaxis, which is at around 28 weeks, we said one injection when she's pregnant, and one after delivery. If the fetus, if the baby is RH positive, then the chance of RH incompatibility, it comes down to around 0.1%, which is 1 in 1,000, which is very, very low indeed compared to the 16% that we discussed before. Now, this is
Right.
regarding pregnancy.
Dr. Ghosh, the question perhaps is how to prevent it. This
Okay.
sounds more like a treatment. I'm already pregnant and I'm going to get a shot at 28 weeks.
Okay.
Another Facebook user is asking, does knowing your partner's blood type before marriage help in avoiding this condition? Is this
Yes, this is.
this prevention?
Yes, this is what it is. It knowing the blood group of the partner before will not prevent RH negativity, RH incompatibility. It is only that if we know the partner's blood group and if it is positive, then the only way to prevent RH incompatibility is to give injections during pregnancy. But one thing can, 2 or 3 things can be done even before pregnancy, like to be aware that an RH negative mother should not be transfused with a RH positive blood. Suppose a mother who is RH, or a woman who is RH negative, who is not pregnant, I'm talking about before pregnancy now, if she's not pregnant and she's RH negative and she by chance needs any blood transfusion, any operation, then we have to be extremely careful that she does not receive any RH positive blood transfusion. The other one is, suppose she becomes pregnant and there is an abortion, or she has a miscarriage, or she wants a termination of pregnancy, then we don't know the blood group of the baby, fetus, because the fetus is not formed yet. In that case, routinely we should give anti-D. So that is another method of prevention. So these are the 2 major preventions, like when the mother is having a termination or abortion or miscarriage or any bleeding during pregnancy, she should receive anti-D. And an RH negative woman should never be transfused with an RH positive blood. If we can avoid these 2 scenarios, then the problem of RH negative incompatibility will very much reduce.
Dr. Ghosh, perhaps the reason came from, in our country, there are a lot of arranged marriages. So during the time when a marriage is being fixed, should parents or should the prospective groom and bride be also aware of or ask about the blood group, especially if the woman is, has RH negative blood group? And
Right.
I mean, is this any consideration for getting married? Because you just said that you can prevent the incompatibility during pregnancy, right? So should this be any reason that you should assess a person for marriage?
Well, a very strong answer would be no, which means blood group negative and positive should not be a ground for not getting married. You can get your blood group done, because all of us should get blood group done, whether we are getting married or we are not getting married. As a child, as an adult, as an adolescent, all of us should know our blood group. But knowing the blood group, and a woman is negative and husband is positive, and more misunderstood is, if the husband is negative and the wife is positive, then also many marriages get annulled, cancelled. And this is because of the fact of a misconception. So we should come with a vehement no, that the slogan should be know your blood group. Blood group incompatibility is not a ground for not getting married. The only thing is that we have to maintain that the precautions are taken, like if she becomes pregnant and ends in an abortion and miscarriage and bleeding, or in a delivery, we should be giving anti-D as per the guidelines. We should not be giving RH positive blood to an RH negative woman. So if we can follow these, I think there is no problem. This should not be a ground for not getting married.
Right. You said that there should not be a reason to reject marriage proposals, but some people get alarmed because of this. So we have a question which has come in. Why does RH incompatibility occur in a woman? You've explained this. The subsequent question is this condition fatal for both mother and child? Now, what I've heard from you, doctor, that this is not a dangerous condition. Yes, the risk to the baby is high, but there are proper ways and means to manage it. So is there any reason for fear or panic?
Right. Well, first of all, the RH incompatibility between the mother and father does not pose any problem for the mother. The mother probably won't know even. But the problem is mainly with the baby. What happens in this incompatibility is that the baby's red blood cells, which actually carry the hemoglobin and the oxygen, they get destroyed very quickly. And so the baby suffers from anemia. And this is called hemolytic anemia. Now, if the baby is anemic, the baby will not grow. The baby's hemoglobin will fall. The heart has to pump more. The heart will fail. Ultimately, the baby will have waterlogging all over the body, which is called hydrops. And actually, it can result in baby's heartbeat getting off during pregnancy inside the mother's womb. Now, if the baby escapes this portion and happens to get delivered, then the anemia will continue, and then a new situation will develop where the baby will develop jaundice very soon after birth. And this jaundice can cause problem in the baby, and sometimes baby can have convulsion. And if this baby survives, then this baby can suffer from mental retardation, failure to walk, development delay, and these sort of things. And this situation is quite common in India because of this RH incompatibility, which has not been diagnosed or it has not been prevented by AntiT.
Right. Dr. Ghosh, we're getting more questions. Can an RH negative man and an RH positive woman conceive a child with medical intervention? Is medical intervention required at all? Because if a woman is RH positive, I don't think there's ever any problem. Is that true?
No, that's not a problem. As I say, if the husband is negative and the wife is positive, that is not a problem at all. It's only in cases where the woman is negative and the husband is positive, then only problem occurs.
Right. Now, we have another question which is coming from a Facebook user. Can Rogum shot prevent further pregnancy loss? Now, it is further pregnancy loss. I just want to try and understand that does this RH incompatibility lead to an abortion or a miscarriage? Because, in the question it says, can Rogum shot prevent further pregnancy loss?
Well, Rogum shot can prevent further pregnancy loss if the pregnancy losses has been due to RH incompatibility in the first place. Now the question is, if the RH incompatibility has occurred and there is a miscarriage, the mother is already immunized. So it's very important to understand that if the mother is immunized already, which means the ICT is positive, as I said, the ICT should be negative. ICT is a test which is done in the mother. In any mother who is RH negative and the husband is RH positive, we do a blood test which is called ICT to know whether the mother is already immunized or not. If the mother is not immunized, then Rogum has a role or AntiT has a role. But if the mother is already positive and she is having miscarriages due to positive, ICT positive, then this AntiT will not prevent further miscarriages. And then we need to treat the baby, affected baby, inside the uterus or after delivery by intrauterine transfusion, as you mentioned, or by exchange transfusion after delivery.
But does this incompatibility lead to pregnancy loss?
Yes. Incompatibility which leads to pregnancy loss. This is the other thing, because what happens if the mother is already immunized, then the fetus will have anemia and ultimately will have hydrops and die inside the uterus. Now suppose in the second pregnancy, first pregnancy usually escapes, but in the second pregnancy, suppose the fetus dies at the age of 9 months or 8 months inside the womb, then usually we see in the third pregnancy, the complication becomes more acute and the pregnancy loss may occur at 7 months. In the subsequent pregnancy can occur at 5 months or even 3 months. So like that, it becomes more earlier on. So as the number of pregnancies increase, the chance of fetal complications become earlier and earlier.
But all of this can be prevented if you take the AntiT shot.
Yes.
Right after the first miscarriage has happened, right?
Exactly. So the whole idea is to keep the mother, RH negative mother, protected with AntiT shots so that she never becomes ICT positive. Blood group negative is not bad, but blood group negative with ICT positive is bad. And the AntiT, the whole idea about giving AntiT is to prevent the RH negative mother from becoming ICT positive.
All right. So now we have another question from Facebook user. both husband and wife have blood group A positive, will there be any issue in conceiving and in pregnancy? Could there be any complications?
Right. This is far removed from RH negative topic which we are discussing today. And there is a common myth among population that marriage between two same blood group individuals can cause problem. This has not been tested by scientific knowledge. So yes, this is some myth which goes on, but that should not be something which will prevent an A positive getting married to an A positive or a B positive getting married to a B positive.
But even if there is no scientific study to this, in your practice, anecdotally, have you ever seen anything like this? Because this is the first time I'm hearing that I'm positive, my husband is positive, will he have trouble conceiving or complications during pregnancy? From all the patients you see, anecdotally, is there any evidence to this?
Right. The problems in the fetuses and the pregnancies occur only if the marriage has been a consanguineous marriage, which means a blood relation marrying another blood relation. In that case, it is not the blood group that is important. There are other genes which are shared in the same family. And when two members of the same family, which are cousin, brothers, sisters, mama, and their bhagni
Relatives.
and niece and nephew, they get married, then what happens, there are a lot of genes which are in common, and these are the fetuses or babies who have more chance of genetic problems. So it's not really regarding RH incompatibility, but as a whole, all over the world, consanguineous marriage is something which is unscientific and they are advisable to be prevented.
All right. We have another question from a user, Facebook user coming in. When would one need to have antibody screening? I think it's the ICT test that you're talking about. When does a mother have that?
Right. A very good question. In fact, the ICT that we were discussing so far, which is the indirect Kim test, is the antibody test. So the antibody testing should be done in all RH negative mothers who are pregnant, I mean, at the very first visit. In the first visit only, we have to distinguish between an RH negative mother who is antibody positive and an RH negative mother who is antibody negative. If the mother is antibody negative, then this mother is low risk. And this mother can be be tested for antibody during her pregnancies. There are protocols, like some protocols say that we need to test from 24 weeks onwards every month. Some say just do one at around 28 weeks or 36 weeks. But whatever it is, we need to check these entities at different stages in pregnancy. And as long as this antibody level, this antibody level remains negative, then there is no problem. At 28 weeks, we need to give AntiT injection to prevent this antibody formation. And I know things are getting a little complicated maybe. So we have to give
the only question I have, Dr. Ghosh, is that you test RH negative mother and when she presents herself with a pregnancy. If her TTR is low in the ICT test, you do nothing. Then at 28 week, if her TTR is still low, why are you giving her the antibody, the Rogum
injection? Yes.
Yeah. Why?
Because we don't want to become positive. Because RH negative mothers should remain antibody free throughout pregnancy, because it is the antibody from the father which is causing the problem. And so we don't want the mother to develop these antibodies. And in order to prevent this antibody formation, we have to give AntiT injection.
So that means all RH negative women whose husbands are RH positive will have to take the Rogum at 28 weeks. Whatever
exactly, at 28 weeks, yes.
Whatever be the picture.
No, they have to take injection AntiT, as you rightly mentioned, at 28 weeks and after delivery. Because at 28 weeks we don't know whether the baby is RH positive or negative, because the baby is inside the mother's womb. So we give everybody AntiT at around 28 weeks when the mother is negative and the father is positive. But after delivery, we check the blood group. And if the blood group of the baby is positive, then we give an additional dose of AntiT. And all this idea is to prevent the mother from developing antibody.
Okay. So during the first child, after the delivery of the first child, the child was found to be RH positive. I took the the AntiD, the Rogum shot. Now, when I present myself with another pregnancy, will I need the shot again? Because now I would have become sensitized to the
No, no.
RH
I
positive
don't
part,
become
right?
sensitized because
Oh,
because sensitization is when we are not giving the antibody. So the mother who has received antibody will not become sensitized. The whole idea about giving antibody is to prevent the sensitization of the mother. As I
but
said,
will she require
she
a
will
Rogam
require a
shot with the
second, yes, she will require a second dose of antibody in her next pregnancy that would prevent her sensitization again. Because
okay.
every time she becomes pregnant, there is a chance of getting sensitized. And this sensitization will cause, sensitization means the mother has developed antibody. And if the mother has developed antibody, then there is no way of preventing any problem because the problem will occur. The whole idea of AntiT is to prevent this sensitization or prevent this antibody production by giving anti-D injection.
But if I've already taken an anti-D injection, why do I need a subsequent one
Correct.
during the next pregnancy? Haven't I
Right.
got the protection from, producing antibodies? Why do I need to take it
No,
over
the
and over?
antibody is not. In that case, we have to understand there are two types of antibodies. One is the passive antibody, one is the active antibody. Anti-D is basically a passive antibody. So once we give an anti-D, that is for the temporary means to prevent the mother developing antibody herself. If the mother develops antibody herself, that is called active antibody. So we give anti-D, which is a passive antibody, to prevent the mother developing active antibody herself. Now, if we don't give anti-D, then the mother will develop antibody and she will become ICT positive. Now, if once she becomes ICT positive, then there is no point of giving anti-D anymore. So the whole idea is whenever the mother becomes pregnant, at every pregnancy, we give an anti-D to prevent sensitization. And at any sensitizing event, which means miscarriage, abortion, bleeding, or delivery, we have to give anti-D.
All right. Are there any side effects of Rogam? This is another question from Facebook user.
No, so far there has not been any problems which are found associated with anti-D injection.
Right. Dr. Ghosh, you said that if in the ICT test we find that the mother is positive and she has a high titer, then there's no point of giving her the anti-D.
Correct.
Then what is the course of treatment? How do you
Right.
protect the baby? Because you said the mother will be fine, but the baby is the one getting affected. So what is the course of treatment there?
Right. It's a very good question. So this is a question where the prophylaxis has failed, which means we have given anti-D or we have not given anti-D. And for whatever reason, the mother is already sensitized. She has already developed antibody. And this is the problem which can occur in, as I said, 16% of cases where the fetus gets affected. And the main affection is by anemia. And the fetal anemia can be picked up by ultrasonography, by doing a test which is called a Doppler test. In the pregnancy, we do a Doppler test, and in Doppler, we can understand whether the baby is anemic or not. So that's how we pick up whether the baby is anemic. Now, if the baby is anemic, then there is a procedure which is called fetal blood transfusion, which can be given to correct this anemia while inside the uterus, because we cannot deliver the baby because the baby is still premature and the baby will die of prematurity if they deliver her. So in that case, we give her blood transfusion, the baby to the blood transfusion, and the baby's anemia is corrected. The baby continues for a few more weeks. We do a Doppler test again. And if we find the baby is still anemic, then we give further transfusions and we carry on till around 36 weeks when we deliver the baby. After delivering the baby, if we find that the baby is still anemic, then we give what is called an exchange transfusion, as you mentioned. That is again to take out those affected RBCs, red blood cells, and pump in O negative RBC so that the baby tides over and the old RBCs will die in few weeks time, and the baby's own RBC will develop and the baby will be fine throughout the rest of the life.
Right. But Dr. Ghosh, this does sound like quite a laborious process. Why we wouldn't want the mother to get to this stage at all? you've given the antibody during the first pregnancy, when the first baby has been delivered. In your practice, how many cases reach this stage even after having given the antibody?
Right. This is very, very rare. If AntiT is given in proper time and in proper doses, it's extremely rare that the mother will develop complications due to AntiT, because she will not develop antibodies on her own. So that is because this AntiT which is given kills the RH positive blood cells of the father, which has entered the circulation, which causes the whole problem. Now, but in cases where the amount of bleed has been more, in that case, for example, in twin pregnancy, in cesarean section, where feto-maternal hemorrhage, as it is called, again, this is something which I have to explain. So this feto-maternal hemorrhage is more, then the AntiT, the standard AntiT which we provide, which is 300 microgram, may not suffice. And in those cases, in spite of giving AntiT, the mother may be sensitized. And that is something which is surprising to her sometimes, that I have taken AntiT before. So why is it that I have become sensitized again and my baby is getting affected? So that chance is there, as you mentioned, but the chance is extremely rare.
All right. So for most cases, a very large percentage is saying that the situation can be managed by giving AntiT to the mother, and she has to be given this AntiT in every pregnancy, even if she has taken it during a previous pregnancy.
Correct. So the question is not, whether AntiT is effective or not, how many times it is to be taken or not. If we understand a market survey which was done in the early 2000s, we know that the requirement of AntiT was about 8 lakhs in India, considering the percentage and the population of India of Rh negative mothers, and the number of AntiT sold was 1.5 lakh, which means there is a lot of unmet need, which means AntiT is required, but the AntiT is not being used. So that is the major concern. The whole idea is to increase the awareness that all of us should have our blood group checked. And if the blood group of the mother is negative, then we should get the blood group of the father checked. And if the father is Rh positive and the mother is Rh negative, the mother should have a blood test, which is called an ICT, which is an antibody testing. And if the antibody testing is negative, the mother should receive AntiT. If we understand this portion only, without going into nitty-gritties of what to be done, I think we can prevent RH incompatibility and the fetuses and the babies' problems to a large extent, from 16% to less than 1%.
Right. Dr. Ghosh, this is the idea that we increase the awareness. But you gave us the statistics, 8 lakhs versus 1.5 lakhs vials used. Now, where does the onus lie? We are doing this show so that everybody comes in the know about this. I may not be I may be very young, I may not be planning a pregnancy, but if I hear this, it would be somewhere in the back of my mind. But who does the onus lie with? Is it with the patient, the mother, who should take the proactive step and ask the doctor to check? Or is it with the medical community? Does this check happen routinely? I mean, is this a standard? Where is the disconnect here? Why should there be this 8 lakh versus 1.5 lakhs?
Well, it's a multi-tier approach, and it should be attacked from all points. And of course, in the center would be the patient. If the patient and the husband is not aware, then nothing is possible. So the whole idea about the whole nation, not only the healthcare professions, the media, the government, and the NGOs, and everybody, all of us should work together to make the patient and the population as a large aware about getting their blood group checked, and to marry each other. And as soon as they're married, they get the husband's blood group checked also, and then follow on from there. So I think all of us are responsible.
All right. All of us are responsible, but this is a standard practice. When you go to the doctor will test you. When you say that I'm pregnant, they will test you, right?
That is an absolute necessary, because if the doctor does not check a blood group of a pregnant mother, they should be considered as negligence. So I don't think there is any doctor who would care for a whole pregnancy without getting a blood group checked. So that is not the question. The question is, many times AntiT is not given. And this AntiT is not given because sometimes deliveries occur in centers, and also AntiT is a cost factor is also involved. Like one AntiT ampoule would cost around 2,500 rupees, and this is very costly. I think one of the areas which can be worked upon is the subsidizing of AntiT. If we can subsidize AntiT to the rural population and the primary health center and the subsidiary health center, that I think would go a long way, because we write AntiT and sometimes the patients cannot buy AntiT. So that's a real question.
All right. So it's not just the testing at the medical level, but even the giving of the AntiT, which is very important, and patients have to be able to afford it. I'm sure, soon there will be a way by which it will be made more affordable and something that one should take for the health of the baby. Now, Dr. Ghosh, one last question. What can we do to ensure that the baby's health is optimal if there is this RH incompatibility there?
Right. So if the only way that we can prevent the baby having complications is to prevent anemia. So if we find that the mother is RH negative and she is ICT positive for very unfortunate reasons, AntiT has not been given before or whatever, and she is RH negative, ICT positive, which means she's already sensitized, then we should monitor the baby by Doppler study, as we mentioned. And once we understand that the baby is anemic, we should give the baby blood transfusion, deliver the baby in a center where it is equipped to give exchange transfusion after delivery. And once the baby delivers, then we have to give exchange transfusion to correct the anemia. This baby will again develop jaundice. So there should be center which is equipped with what is called phototherapy. And if phototherapy is given, this is a treatment for jaundice. So treatment for anemia is blood transfusion. Treatment for jaundice is phototherapy. If these two are given in a center where there is a very less chance of infection, then in majority of cases, the baby comes out fine. But if that is not given, then the baby can develop convulsion, which is called kernicterus, develop mental retardation, and this is really a very poor thing, because all these things could have been prevented with one shot of AntiT.
Right. That's really very critical for mothers to take that AntiT should they have the negative blood group. Thank you so much, Dr. Ghosh, for joining us from Kolkata and answering all the questions that you've taken up on RH negative blood group. I'm sure, with so many questions answered, there'll be greater awareness and perhaps even some relief among maybe planning families about the blood group. Thank you so much for joining us. If you have any more questions, you can send them to us on WhatsApp. You can use it to click on the WhatsApp button on our page and send us your queries. Don't forget to follow us and stay updated on all the concerns about health and well-being. This program was supported by Bharat Serums and Vaccines Limited under its Public Awareness Initiative. We'll be back with another special show on RH negative incompatibility next week, same time. Do follow us on Facebook to get all the updates about our upcoming shows. Keep sending us your questions and we'll certainly include them in our next show. Till then, stay home, take care, and stay safe. Goodbye.